Salt is often called the heart of every dish. But for patients with hypertension, it's also the heart of many concerns. How much is too much? We all need to know. Let's turn to an expert for clarity regarding ideal salt intake for managing hypertension.
Daily optimal salt intake is important for an hypertension patient. According to guidelines, the recommended daily dose for salt, especially sodium, is less than 2 grams per day for an adult hypertension patient, which is roughly around 1 teaspoon of salt. Which is if the hypertension patient is going to take less than 2 grams per day of sodium, then it will help to control their blood pressure and avoid adverse cardiovascular event also.
Thank you, doctor. Your expert advice will empower patients to strike the right balance, savor their meals, and successfully get to goal for healthier blood pressure. One of my relatives has high blood pressure, but tracks it diligently twice a day, keeping a record to stay in control. While some friends tease him, it raises the key question: how crucial is regular BP monitoring, and what's the best way to do it at home? Doctor, please, could you share your expert insights?
Yes, regularly monitoring BP in a hypertension patient is very crucial, and it should be twice a day or at least 3 times in a day. You should monitor. The framework is you should maintain your posture while taking the BP, and the cuff placement is also important, and avoid smoking, caffeine, and exercise at least 30 minutes before measurement of the blood pressure, and take at least 5 minutes of rest before taking the measurement of blood pressure.
Thank you, doctor, for clarifying this important topic. Your guidance inspires patients to take control and confidently get to goal with their blood pressure targets. Exercise is often called the best medicine, but is it the same for hypertensive patients too? If yes, which type of exercises are recommended and which are to be avoided? It's so confusing. Let's ask our experts for insights on the role of exercise in managing high blood pressure and whether there are specific types or durations of exercise recommended for better control.
Regular exercise help to control the blood pressure. There are different types of exercises, aerobic and muscle strengthening exercise. Personally, if you're going to ask me, I prefer to say aerobic exercise like walking, jogging, cycling, swimming. It helps to reduce the blood pressure, and it's good for the body also. Muscle strengthening, muscle strengthening exercise also you can do, but personally I recommend for aerobic exercises. But if you want to do muscle strengthening exercise, you can do it for 2 days in a week, and aerobic exercises you can do at least 75 minutes in a week of moderate intensity aerobic exercise like walking, jogging. You can do. It will surely going to help to reduce your blood pressure.
Thank you, doctor, for highlighting the critical role of exercise in managing hypertension. Your advice will help patients incorporate the right physical activities into their routines and stay on track to get to goal with the blood pressure targets.